So welcome. We're at Ventana treatment programs, and we're meeting with outpatient today. So this is the PHP IOP program, which we're not going to go in and explain, but it's outpatient. You're coming to program during the day, you're going home at night. Basically, that's essentially it. And you're receiving therapy, right? So I'm Lori Holdren Scott. I am a licensed marriage and family therapist and director of clinical supervision at the outpatient program. And I am here with...
I'm Christina Navarro. I'm the clinical director for the outpatient program. I'm a licensed marriage and family therapist. And I have David.
Yeah. Hey, I'm David Ruda. I'm an associate professional clinical counselor and a primary therapist here in the outpatient programs at Ventana.
And we're going to talk today about manipulation. And how this came about is I found that I was getting a charge from hearing my associates that I am supervising say, oh, my client lied to me. Oh, they're manipulating me. And that it was a negative. And I thought, I don't think of manipulation that way in terms of our clients, but just in general in the world. Yeah, we can think of nefarious people who are manipulating, we can think of the extremes. We can think of movies like Gaslighting, where they're trying to, solicit maybe murder, poor Ingrid Bergman, but she survives. So for me, in conversation with Sharon Volner, who's our chief clinical officer, it always came up. And so we decided just to have a casual conversation about it, but it's become more. Christina has perspectives on it. David definitely does with his years of experience as a clinician. So for me, it was always more about the associate, the clinician, or even when I was direct care staff, working with other direct care staff, and they're like, oh, this client's so manipulative. And I thought, well, yeah, we all manipulate to have our needs met. And so I looked a little more into it, and manipulation starts as early as 12 months. It's a learned skill, cause and effect. So if I fall down and I start to cry, or I go, and somebody picks me up, ooh, I got a hug, I got my needs met. And then it becomes verbal when you get to about ages 3 to 5. And then you're learning a little bit more skills, especially when you're 7 and you've learned the rules of the world and red light and green light and stop and go. It becomes a little bit more, I really want a cookie before dinner. Which parent do I go to get that, right? But what's the intent? And that's always when we're sitting with our clients, they want us to like them. They want us to see them in a good light. So they may, not tell us their whole story to begin with. They may withhold some information, or, they're going to try and manipulate. So we are on their side, and they're not the identified patient. Everybody else in their family is bad. So it's sort of natural. And I liked what I read about it a little further, is that manipulation is a neutral tool. So think about like fire, that we use fire to like cook our food, to warm ourselves. Or here in California, we have a season where it's destroying things. So it can be used either way, which is the same way manipulation can be used. And so it's always, what's the intent and how is that person coming forward with manipulation? So that's kind of how this, let's talk about this topic came about. And it helps me in my own life to now look, just as walking around in the world, look at people. What do I feel in my gut? And they talk about feeling your gut. Like, is this person manipulating me? Is this for good or ill? Is this only going to benefit them? And if it is, do I get a residual effect of, oh, it felt good to help that person? Or do I just want to set a boundary? It's like, I just don't have the bandwidth to give whatever they're trying to get from me. So it's kind of nice to look at it that way too. It's not just with clinicians, but it is just in your everyday life.
Yeah.
How to go about.
I think that goes to like the definition of like what is manipulation. And really it's like the influence on a person. So when she's talking about knowing like boundaries, like manipulation is, we say a lot of things are on the spectrum. Where along the line does it fall? When it starts out as just something that you are maybe trying to have a need met, and maybe the impact is not so bad. Or maybe it might even be a positive for both you and the other individual, to then maybe having a negative impact on the other person. So,
Yeah. And when you were talking, Lori, it made me think a little bit about, always kind of holding a little bit of room, in the gut feeling of, is this person being transparent or honest with me?
Yeah.
Because I think when we make, 100%, they're lying, they're not lying.
Yeah.
That's where we have some error, right? And so just kind of holding some space for the fact that we think this is what's happening, but we're not fully sure.
Right. And can we curious and neutral. I love that word now in relation to this, and investigate and try and make connect, say, oh, well, you were saying this and this connects to this. And but how did this come about? How did that feeling, helping them discharge some of what they feel they've, like you said something before we came in, you were talking about like sometimes it's behavior and they cannot not do this and what that looks like.
Yeah.
So how do you get someone to understand they don't always have to manipulate intensely?
Yeah.
Always, because that's,
Yeah.
well, you should speak more about
Yeah.
that.
I think for me, I think about it in one way, like from a behavioral perspective of it being conditioned, right? When you reference how early we learn manipulation, it makes me think about, how much we're conditioned to it. And on top of that, there's certain, mental health diagnoses that very much use and engage in manipulative behavior as a way of living.
Yeah.
Right. It's kind of what allows them to survive. And so I think because of that, that also can impact, family dynamics because someone feels like someone else, is consistently behaving in a very specific way that is intended to, right, evade the truth
Yeah.
or evade, what's happening.
Yeah. And that becomes exhausting for the family members. We see that all the
Mhm.
time with family members of our client. They're just exhausted. They don't know what else to do. So they've set these really hard, like it has to be black and white. But
Mhm.
that's not the skill that person learned to survive in this family. Even if there were 3 kids, they were all raised the same. Someone else is affected differently. Someone
Yeah.
else has a different way of trying to get through
I wonder if
their
it might
family.
be like helpful to give an example of like how that might come to be for somebody who is in a treatment program and who has a diagnosis where manipulation might be something they engage in regularly to have
Yeah.
their needs met.
Yeah, I think a lot about substance use disorder, regardless of the substance, and personality disorders. Certain personality disorders maybe over others, um, but I think about those, 2 specific categories because I think that that's where we see a lot of manipulative behavior. Um, and I think I've ended up working with a lot of clients over, the time that I've worked with, with different populations with like close to substance use and that there's a family member or there's someone else that has been abusing substances. And I've usually kind of focused on, making sure that person can understand, manipulation as a way of survival, because oftentimes it has more to do with, right, meeting a need, right? And that need often is what's fulfilling the addiction, right?
And when
So
you're
it's
talking, yeah.
not personal in that
Yeah,
way.
it isn't. Yeah, exactly. And it made me think about when you're talking about that, like they're using as a way to regulate themselves,
Mhm.
and then it brings their anxiety down, or it brings their mood up a little, and with the addition of the drug or whatever, and it's just a vicious cycle. But it is you're trying to regulate yourself
Mhm.
either by setting boundaries or using some manipulation that you're not really conscious of. You just know you're trying to get a response that you hope is going to be positive for you.
Yeah. And
And when it's not, then then you go in harder.
And there's a behavioral piece to that in the sense that when I learn what works, why would I not continue to use it?
Perfect sense. Yeah.
If I know it works, then
Yeah.
I can easily go back to it.
Yeah.
Yeah.
So how do we move our clients or even families move loved ones from that dynamic, that cycle? Because I always think in terms of family systems, because that's what
Yeah.
I love family systems. It's that feedback loop, right? And it just keeps going and going. How do you disrupt it? As soon as you try and disrupt it, then the family fights, the system fights to keep it the way it is. So how I guess do we move our clients out of that behavior so that
Yeah.
they can feel strong and productive? And then the family the system, their loved ones, whoever it is, their friends, trust them.
Yeah.
You know?
I think a little bit about boundaries, right? I think boundaries are helpful in that instance, as well as like I'll frame it as empowerment, but really what I'm getting at is more kind of like motivational interviewing tactics or motivational interviewing techniques that are, empowering people to be able to see, behaviors for what they are and not, interpret them as someone is intentionally trying to
Right.
use you.
Right. Exactly. Yeah. Being able to figure out when it has that malicious intent and when it's just all of us walking around the world trying to get our needs met and trying to feel good and get whatever it is we need.
Yeah.
I just think it's like a lot of education with family members or like significant loved ones or primary support, even if it's just their friends.
Yeah.
A lot of people have a lot of misinformation that they get from like social media. Like how many people do you know that like diagnose themselves or they think they have something because they looked it up or they know it on the internet, but they don't know how to use it. And then trying to kind of go in and assess like where's the family as far as being informed and then being able to introduce like the idea of like manipulation to get a need met. And then it turns into maybe a maladaptive like skill, right?
Yeah. Yeah, it does. I think that's kind of like I think of coping skills. I wish we could all walk around and see people on street corners doing their deep breathing, their 5 through, it just is a normal part of society. But the same thing with society is like deconstructing that word manipulation. So it's not thrown around so negatively. And we can just see it as a neutral tool.
I think that kind of brings us back to like what you were saying with like clinicians and like when you're supervising is it all starts with us and having an understanding of like where we fall on the line of that and whether or not we can remain open because a lot of people do have a negative charge like when it comes to hearing that word. And as a clinician, if you're like using it and you're not aware of that, you kind of already shut the door to like being curious about what is actually happening here. Why might they be trying to do this? And like, where you should move as a clinician as far as like in session with them to kind of figure out and all.
Yeah. I mean, I think when I think about, one of the benefits of an outpatient program, right? I think you have a greater opportunity to see manipulative behaviors than you do in any other kind of therapeutic context, right? Because in private practice, I really only have one story unless I happen to have a collateral session with a partner or some other family member or something else. And then I have another aspect of that story, but I really only have, it's one dimensional, right? And here, right, someone's interaction with all three of us and telling three different stories, we can realize there's something there. And that's probably something that one of us needs to have a conversation about the fact that you're telling three very different versions of this story.
Same story. And you get to see the whole milieu of everyone interacting in group. And that's kind of the beauty of group therapy is just people from all walks of life, all ages, all coming together in some form of pain and distress and going, oh yeah, we are nowhere close in age and maybe did not grow up on the same coast, but I recognize that. And then it sort of opens it up for the first time for them that,
I always find it interesting, like who they decide to tell what. Like, why did you get that version of the story? Or like, why did you get that version? Which I always go back to like attachments. Like, which we also love.
Exactly. Like whoever we're reminding somebody of. Exactly. And how so they get to play it out in front of all of us because we have 5 clinicians. We have 2 directors. We have, our floor staff. So we have a lot more eyes on who are going, oh, did you know that? No, I didn't hear that. And it's really helpful. It's really nice. And it's really nice for individuals coming to outpatient, coming to a group therapy program to also have that experience. Because they're kind of mimicking their system, whatever that system is they came from. That has caused them distress,
And I think, we also get a chance to observe clients developing peer support where there's a level of reinforcement there. And, the beautiful thing is to see clients, check each other when they're experiencing that and not have us point it out. Right? Because that's an indication that someone feels confident enough to be able to say, hey, Christina, I want to bring this up to you because it's really affecting me.
Yeah, exactly. Or I want to thank you so much because you really heard me and I want to offer you that same support. It's great when group therapy works. It everyone works together. And for them to feel that too. But that was.
And I think it's like social influence is like probably one of the biggest things in everybody's life. is that we start that from an early age, and then as we get older, you hit different kind of developmental markers, and like the influence gets even greater. You know, and
Oh yeah.
you know that goes into, you see it all the time in like films, like you know, like Mean Girls. You know what I mean?
Oh yeah.
Like the
Yeah,
power
I
to
just saw that.
belong, the power to like influence, and
Yeah.
you know, it kind of brings us back to that whole like starts as a
Yeah.
survival, and
Yeah.
then goes into peer influence, and you know, and that's probably about the time we should learn whether something's good or bad, right?
Yeah.
Because of how
exactly.
it
Yeah.
impacts you. Like you
Yeah.
do something because someone peer pressures you into something and it doesn't do well, like should be like our markers for maybe those are not our type of people to hang out with.
Yeah.
So
No, it was interesting because you brought up Regina George when we were talking earlier, whatever, and I went, I said, but wait, what about Katie? Because Katie is a little bit more evil, if we want to look at it that way, than Regina. Regina's kind of transparent about she's in control and she's got everybody doing everything. But Katie comes in and goes, oh no, I got you. I'm going to take you down. Oh, that's a little more insidious. That's a little bit more under the
That's true.
radar, you
Yeah,
know?
that's true.
And that made me think of it because we were,
Well, it's
word
an interesting
manipulation.
perspective because
it
everybody goes
is.
to Regina George, right?
Yeah,
It was like,
right.
yeah,
Yeah.
she's the mean
But-
girl,
yeah.
but she actually plotted it out and
Yeah.
like had a plan. And I was like,
Yeah, exactly.
actually, she's right. That was
Did a little of that, yeah. So, yeah, when that's a great movie to see when it doesn't become a neutral tool anymore. Then it's has
Yeah.
a little bad intent. Yeah,
Yeah.
exactly. But yeah, just wanted to like see if people could think about neutralizing that word for themselves. So I think it changes everything, like you said, to develop boundaries and how does that work, and maybe that's all I need to do. But then that's a big job.
Yeah. I think there's boundaries. I think
Yeah,
the
it's
other
not-
piece is that there's an emotional aspect. I think both to anyone that's close with that and with clinicians, right? Because we want to believe that clients are being truthful. We want to believe that people in our network are being truthful. But when we feel like they're not, we have an emotional reaction to that.
Yeah.
I think, I mean, that definitely goes to the intent and impact, right? Because like with intent, you're talking about like secrecy versus like transparency. Like intent, if you mean it to be good, you're going to be transparent and honest. If you don't and you mean it in a negative way, there's going to be a secret in that message. And you can usually tell by people's like tone of voice or like how they approach it, right? Like if I'm being transparent, I'm just telling Lori straight out, like, I'd really like you to do this with me because it would mean a lot.
Yeah.
Versus,
Exactly, because it is that meaning behind it, to be transparent instead of just honest. Right.
yeah, versus like a hidden motive. Like, well, if you were really my friend, you would just do this.
Exactly.
Like,
Exactly. Oh, that felt
Can you imagine if I
manipulative.
talked to you like that?
Yeah.
No, I'm just kidding.
No, I can't.
Yeah. Yeah. And then, and like the impact of it and like what that holds.
Because then you have to be willing, if you're not manipulating me, to take my, oh no, I really can't.
Right.
And that's always hard. There's the emotional piece of it, right?
Mm-hmm.
So
Well, that's interesting because somewhere I read too that part of why people see it as a negative is they feel like it takes a person's sense of agency, like when it's negative,
yeah.
because you're manipulating something in such a way to, that it takes away the autonomy of choice because of how it's being like painted. But that's where the secrecy would come in.
Yeah.
Versus like transparent, that person would have all information and still could make a decision either way.
Yeah.
Yeah.
And feel comfortable with it. Yeah. It's that comfortability.
Yeah.
We were talking about like the different types, like gaslighting or like coercion or like the
Isolation.
powers, the power differential, like, the parent-child or the teacher-student, or
Yeah.
boss employee,
Yes.
Yeah.
and
That's another aspect.
yeah, and just how that plays a part and a lot of people don't realize.
No, because we just go about our days doing what we do.
It's like the everyday manipulation or like social influence that people just don't even realize.
Well, you think, we're going to be doing social media detox, but that's the social media aspect with the TikTok and the influencers, it's all manipulating you
Yes.
Yeah.
It is.
into their world, into seeing things from their perspective. Yeah. We could get the fake news and all that stuff.
Yeah.
Yeah.
Any final thoughts on manipulation?
I always
favorite
fell in
words,
line with you. You and I have been together for 15 years. And
Mhm.
we always generally fall in line around the same things. And manipulation for me was always same thing. negative connotation, and that's, but everybody manipulates, and that's always been like our viewpoint.
Yeah.
David agrees. Like,
Yeah.
I think we all agree on that.
Yeah.
We all do to meet our needs. Sure,
So-
we all did this morning at some point.
Yeah.
I'm sure.
The
we
first
did.
half
Yeah,
of this
I'm
day,
sure
we
did.
all
Yeah.
manipulated
Yeah, something.
somewhere.
Yeah.
in
So
here.
I think part of what I'm hearing from Lori also is like this message of like keeping an open mind, right? Part of what that neutrality is to allow you to be curious about how you're experiencing something.
Yes. Yeah. Just in your own personal day.
Yeah.
Exactly. Beautifully stated.
It's just even be curious. Not even just about what they're going through, but if you're curious about as to like why they're manipulating, even if you just are curious around that, you're going to find like a whole wealth of
Or why
information.
you are too.
Yeah.
It takes a lot of mental effort, but once you get used to it, it's like anything you practice.
Oh.
Yeah.
Yeah.
All right.
Thank you for watching this episode on manipulation with La Ventana's outpatient staff. You can find us on our website, YouTube, Facebook, Instagram. We'll see you for the next episode.